Hi, welcome to City Vision's Holistic Personal Health and Spirituality course. I'm really excited about this course. I think this is going to be one of the most important courses we have here at City Vision and has the potential to bring a lot of benefit to our students. So, one of the reasons why I wanted to develop this course for our students is, over the years, so our mission is largely to serve students that are, working to serve the poor and the addicted. And I've seen how, that's a really stressful type of calling. And a lot of our students and, many of our students will come from, lower income backgrounds too. And I started to see, over the years, we've had a number of our students who, are older adults and they die early. And, the top reason we've seen that happen actually is, some of our students who are in recovery, they've relapsed. But the second reason is honestly poor health habits. So we wanted to give a tool in this course that would not just bring knowledge, but could bring change. The other reason is it's personal for me. So, I grew up poor. I grew up in an environment, I'm from Kansas City, and folks from Kansas City take pride. We like to think of ourselves as one of the barbecue capitals of the country. And we take pride in, I remember whenever Kansas City was selected as the highest obesity rate in the country, and a lot of people in Kansas City were celebrating that. We lost it now to a lot of cities in Texas, but taking pride in this unhealthy eating as a part of the culture. And I grew up like that, and I didn't take good care of my health. And in my 30s, all the stress and poor diet and lack of exercise. I basically had a life burnout in my, life. My, energy levels went through the floor. I couldn't get through the day without taking a nap. And, I realized it was because I ignored my diet. So I had almost, another, conversion experience. And I realized that, I had been taught kind of this false theology that the body's bad and I needed to focus on my own physical health. So that's my own story. So let me just tell you what this course is about. So, we use the Daniel Plan, and I'll talk a little bit more about that in a minute. But that's the primary framework for this course. And the Daniel Plan has 5 things: faith, food, friends, fitness, and focus. So that makes up 5 of the weeks. So we start off on faith and the foundations for holistic personal health and spirituality. Then we go into food and nutrition. Another week that's focusing on how our friends affect things in terms of, what we eat and our fitness level. But also that week we cover, and we're using a textbook in addition to the Daniel Plan. We're going to cover, body composition and weight management. And then 2 weeks on fitness. So first on fitness overall, and then cardiovascular fitness and preventing cardiovascular disease. And then on week 6 and 7 is really going to be focused on what they call focus. So that's stress management, avoiding addiction. And in week 7, we're going to really focus on the relationship of physical health to mental health and addiction. Now, I see people, and this is also, one of my stories was, I have a recovery background, and my addictive pull was really strong for decades. And I learned through a lot of normal recovery principles to stay sober, but it was like I was carrying this 800-pound weight. Once I started working on my physical health, that weight went away, and I lost the addictive pull. So that's a big reason why. And also I had kind of a chronic low-level depression, and that went away too. So I want people to understand the relationship of physical health to mental health. And then in the end, this course is about change. So, how do you create long-term change in yourself and in others? And that brings me to the next slide, which, most universities are focused on what's called cognitive learning. That's your head. In Christian circles, you often hear about the head, the heart, and the hands. And in academic circles, you call it the cognitive learning, the affective learning, and the psychomotor. And, in Mark, Jesus commands, love the Lord with all your heart, with all your soul, and all your mind, and with all your strength. So you have your head, heart, hands all together there. And that's what we're trying to do in this course. And this course is going to be more about changing health habits, and that's really your heart and hands, than just learning about health. So we're going to do that, but we're going to be learning about health to bring real change, because learning that doesn't bring any change is just kind of a waste of time from my perspective. So in academic circles, they call this affective or heart level learning. So I'm going to use Christian faith as an example of what we would use in terms of a learning taxonomy. So the first level, and this is what you take in an education course, they call it receiving. So in a course, that would be participating in the course. So you're receiving, and it's really more compliant. So towards faith, that would be like a child who attends church. And I remember as a teenager, I attended church, but I wasn't following God at all, right? So later in life, I actively learned about Jesus in my own time. So that's responding. So that's where you commit to a practice or continually learning a topic. So that's where, in this course, I'd like you to not just do the required stuff, but to actually be into it, to try to learn about this. Then, what we're really trying to do is to get you to value this. Ultimately, my change didn't happen in my life. I had to learn about health, but I had to value my own physical health. So, as a Christian, what we're talking about is a conversion makes a decision to follow Jesus. And then, in Christian circles, you have this term sanctification. So that, in learning theory, that's called organization. So you're following Jesus slowly reforms your life. And so that's where the topic changes your practice. And then the characterization. So you're trying to, Paul said that he was trying to live like Jesus. We're following Jesus. We're trying to characterize Jesus in our life. So that's a Christian faith. Now, I'm going to use another example on personal health, not to compare a personal health conversion to the same, because it's not even at all as significant. Having said that, we have a holistic mentality that your body is an important part of, taking care of that is an important part of following Jesus in general. So in this course, you're compliant, you're taking the course, right? So we want you to get to the point where you're actively learning about health in your own time. A lot of times I'll just be walking around and I'll think of something and I'll look it up and try to, watch a short video or whatever. So that's where you're responding, valuing. So, I talked about this wake-up call that I had where I couldn't get through the day without taking a nap. I was depressed. I had this kind of strong addictive pull that I could resist, but all those things made me realize that I needed to change. And honestly, the biggest motivator was the fact that I had kids and I didn't have the energy to really play with my kids like I wanted to. So that was the biggest motivator. So I went through kind of this health conversion experience from being one of the least healthy people you'd ever meet to being, more healthy. I don't know that I'm the most healthy person you'll meet, but so what I did is over time I learned more, and this is kind of a cycle. I learned more and I improved my health habits, and I gradually, adopted more of a healthy lifestyle. And what we're trying to do in this course is to help you to take steps towards this, where you can characterize healthy living in your life. So now this is the affective domain. So this is the heart. It's still important. Like a lot of our courses, you've probably seen this many times if you've taken many courses. So this is the cognitive learning. So you're going to take notes as you go through the videos. If you really want to get this, if you want to get mastery and, highlight your books and things like that. And then we're going to try to get you to, not just remember and regurgitate content, but to understand. So we have forums and quizzes. The quizzes, keep in mind, the quizzes in this course are not very much of your grade. A lot of people, they love quizzes. They think it's going to be a lot of your grade. That's not what this course is about. The quizzes are there to just make sure you have some basic understanding. Don't spend too much time on them. They're open book. But we want to make sure that you're retaining the material, because you're not going to be able to apply it. So, the live meetings, some of the forums, and then in the assignments, you can kind of do analysis and come up with ideas on your own health plan. So you'll have a 40-day health plan, but at the end of the course, you're going to have a long-term health plan. So let me try to, talk a little bit about what's different about this course. So as I mentioned, focus on changing behavior rather than only changing cognitive learning. And, heart and hands are a high priority in addition to the head. So more video content. And many of you are going to say, wow, this course has a lot more video content than a lot of courses. Part of the reason for that is video is a lot more effective at being motivational. We're trying to help motivate, students in this course, but it's also often more current. By the time something gets in a textbook, it's almost like trying to pass a bill through Congress. You have to go through so many things that often, the stuff that gets into textbooks are, it can take a while. So a lot of the video content is a little more cutting edge. Another thing's different. Most of our courses have 2 Zoom meetings. This one has 4. Part of the reason, and part of what the Daniel Plan is you need a supportive community around you to make change. So there's going to be 4 Zoom meetings to provide more opportunities for peer support. Another thing, so if you take a normal personal health course, often they're just focused on the science, of personal health. But we view physical health as one component of a holistic spiritual health. So it's not spiritual versus physical. It's physical is, within this larger circle of spiritual. And another difference is we're taking an interdisciplinary, the term in public health, it's called socio-ecological model of health that considers personal choice, health science, culture, and structural factors. Now, part of the reason why we want to talk about the cultural and structural factors is that a lot of our students work in stressful, low-income environments. Some of our students come from, low-income backgrounds, and often some of the big barriers there are the cultural and structural. And we're going to present these not as, oh, let's just blame it all on the environment. We're going to actually train you to get, help with yourself and with others to provide tools to overcome those things. So now another difference in this course is, one thing about this course is we're using the book, The Daniel Plan. And what the Daniel Plan is, many of you may be familiar with Celebrate Recovery. It's a Christian recovery program that came out of Saddleback Church. It's similar to that. It's a church-based support group program to improve your health. As Rick Warren says, we're all in recovery. We're all trying to improve our health. No matter where we are, we're all trying to improve our health. So it was initiated by Rick Warren at Saddleback Church. He's one of the authors. It's the most widely used and successful health program in the world for churches. It's been used by more churches and had, more positive outcomes than any other program. It's also designed to be read and implemented by individuals. So, you don't have to do this through a church. And, part of the reason why we're doing the Zoom meetings is to provide that peer support. But part of what makes this great is not only is the spiritual aspects of it very solid, the science of it is great. So I mentioned to you that I kind of had this health conversion experience. So, I'm an avid learner. I'm always, I read enough books that would be the equivalent of a master's degree every year or two. And I've read probably 50 to 100 books on health and science. And, what you realize is the average person, they think it's all confusing, and it is, because most of what's out there is misinformation put out by, companies that benefit from misinformation. But once you start reading, I would say out of the 50 books I read, probably 40 of them all converged on the same 90% of recommendations. Now, they all have their own different flavor, but they all have similar recommendations. And Dr. Mark Hyman and Dr. Daniel Amen are 2 of the most prominent doctors in the world, and their science is very solid. Many of you know I'm an MIT graduate. I care about solid science, so their science is really solid. Mark Hyman was an advisor to President Clinton on his own health. So this combines good spirituality with good science in this, but it's also been very successful in bringing change. So with all that, let me just summarize the course outcomes in this course. So, we want you to be able to reflect on the biblical basis of focusing on physical health. 1, 2, value and prioritize more highly your own personal health in order to improve life balance. Part of the reason why I didn't change is I just didn't value that. I valued other people better. That's bad theology if you're not able to love yourself. The Bible says to love others as you love yourself. You have to be able to love yourself. You have to be able to care for your own health. And I was honestly just giving out too much to where I was burning myself out. Develop and follow a nutrition plan to develop healthy eating habits. So notice there's 2 words in that. We're not just going to have you develop a nutrition plan, but you're actually going to follow it. for a 40-day period in this course. Develop and follow a fitness plan to develop healthy fitness habits. And you can kind of think of this course as a little bit like a boot camp to help you improve your health overall, to kind of kickstart you towards, improving your health overall. Track progress towards a 40-day food and fitness plan you will follow in this course with the support of classmates and faculty. So that's what that is kind of that boot camp. And then the last components are develop strategies to address barriers to changing health habits for yourself and others, including soliciting the support of friends and minimizing negative influences that could be from culture or structural reasons. Improving your mental and emotional well-being by creating margin needed for health, managing stress, and following healthy habits. And then in the end of the course, what we're trying to do, you kind of go through this, 40-day period, and you're going to try to do something that, you may be like, okay, I can't avoid, say you're going to cut out soda for the 40-day period. You're like, I'm not ready to commit to cutting out soda for 40 days. But then you might try that and you might be, you know what? I got double the energy. Honestly, whenever I did this health conversion experience I got double the energy. So it was all worth it. The cost was very high, but double the energy was worth it for me. So you're going to find things that make it worth it for you. And then what we want you to do is design kind of an ongoing health plan. You may say, you know what, it was too intense to try to do all those things for the 40 days. I don't think I can do that always. But we want you to develop kind of your whole plan. So let me talk a little bit more about what that 40-day plan is. So in week 2, you're going to develop a food plan. In week 4, you're going to develop a fitness plan. We want you to pick goals that fit you. Don't try to overdo it. Some of you will have health conditions. You got to keep those in mind. And we're going to do food tracking for 1 week and activity tracking, throughout the course. And then we'll also have a personal health learning journal weekly. And in this, you're going to have different components. You're going to have reflecting on personal and spiritual aspects of the material. You're going to track your progress towards your goals. You're going to reflect on and apply the material. And part of the grade is, so we have a lot of these videos, and we're going to ask you to be on the honor system and say yes whether you completed the material or not. That's going to be part of your grade. And, we're Christian University. We're hoping no one's going to lie about that. And if you don't, just say what you didn't watch in a given period, but we want you to be able to go through the material. So this is 100 level course. So it is important that you go through the material. And then the other thing is, some of you will want to go above and beyond. And there's so much good material we had in this course, but we didn't want it to be overwhelming because it's a 100 level course. So we put quite a bit of material that is extra credit. So there are extra credit chapters in the textbook, and you can get credit for those by taking the quiz. But if there's optional material in your learning journal, we'll have a section where you can write about the optional material that you went through, and you can reflect on that, and then you'll get additional points for that. So as I mentioned, I'm really excited about this course. I think you'll benefit a lot. And if you have any questions, please ask your faculty members.